Can you all hear me okay? Yes, okay, great. So first I just want to thank you for having me today. I have to say your conference is really impressive. I looked at all the activities and speakers you have and wish I had been invited earlier than today. So I am a pediatrician in private practice in town with Journey Pediatrics. And I'm also a member of the American Academy of Pediatrics and serve on the immunization committee for our local chapter. I will right now do a shameless plug that the New Mexico Pediatric Society is open not only to pediatricians, but also nurse practitioners, PAs. So if you have any interest in education and advocacy for kids, please join our forces. We'd love to have you. So I have no conflicts of interest and I will not be discussing any off-label use of any products. So I'd like to run through a little bit of historical perspective with you all, hopefully some interesting facts, but I'd really like to give you the tools that you need to feel confident in not only discussing vaccines with your patients, but able to answer those questions, as well as going through the schedules, a little bit on vaccine exemptions, definitely touching on some vaccine hesitancy, as well as the VFC or Vaccines for Children program, and then again, make sure you have some resources. So why do we vaccinate kids or adults? It's really quite simple. Vaccines save lives. So when I leave a patient's room and they're waiting for their vaccines and I ask my medical assistant to go in and do their vaccines, often, especially when it is a cute, squishy baby, they feel guilty about having to go give shots. And I tell them, and I mean this, you could be saving that baby's life. And that is true. So when we look back through, how did vaccines even come about? Well, this is Dr. Edward Jenner. In the 16, 17, 1800s, smallpox was really ravaging the world. So in Europe alone, over 400,000 people died every year from smallpox. It was very disfiguring. And what they noticed was milkmaids tended to have beautiful, clear skin. They didn't get smallpox. So Dr. Jenner decided to do an experiment which would never go over today. And that is, he took the pus from a cowpox lesion on Sarah Nelms, who was a milkmaid, and basically scraped it and injected it into an 8-year-old boy, James Phipps. So he did get sick. He had some cowpox lesions, but didn't get that sick. So then Dr. Jenner said, well, now I'm going to take pus from a lesion of somebody who has smallpox and scratch that into his skin, and he didn't get sick. So while how he went about it, you might find questionable, the fact is he understood that by exposing this boy to antigens or things that our body produces responses to, it actually helped protect him from the illness that they were trying to protect them from. So the word vaccinia, vaccine, comes from the Latin word for cowpox. So what does this mean for us? Well, the 1918 flu pandemic that I feel like we are all getting to now live in our own time was a really, really big deal. But the issue was, one, it was caused a worldwide problem. Over 500 million people were infected with the flu. That's a third of the world's population. There was no vaccine. So it spread quickly. It was very deadly. About 50 million people died worldwide. And in the US alone, just under 700,000 people died. So there wasn't a lot to do other than to have these huge wards and try to take care of people. So when finally a vaccine was available, it was in the 60s, just starting to be recommended for certain high-risk people. So not everybody, but if you're high risk. Well, now it is recommended for everybody who can safely receive it. So the latest data I could find was the 2018-2019 flu season. In the US, there were, let's see. Yeah, so worldwide, 35.5 million. Only 34,000 people died in the US now, and about 500,000 worldwide. Still a lot, and still too many, but significantly different than 500 million people getting infected and 50 million people dying. So really you can see, and with our much larger population now, so you can see the benefit of that. Here are two other things. Who in this room has seen a case of measles? A few. What about Haemophilus influenza B? Nobody, and that's awesome. So with measles, measles is something that is highly contagious. It can stay airborne and active for a couple of hours. So an infected person, about 9 out of 10 people around that person are going to get infected with measles. Measles is also a big deal because if we don't have 95% of our population immunized, if it's lower than that, then that puts us at risk of having outbreaks of measles. Since we've started immunizing kids, and this was the MMR vaccine was licensed in 1971, we generally don't see it anymore. Haemophilus influenza B can cause severe illness, and actually kids under 5, pretty much they all got it. About 1,000 kids a year would die from it, but you can get encephalitis. So when I was a pediatric resident at UNM, thankfully I didn't see it, but those who trained not that long before I did would routinely have sick kids come in. They'd have a fever, they suspected meningitis. They would do a lumbar puncture, and instead of spinal fluid coming out, frank pus would come out. So I love the fact that I've never seen this before, and I sincerely hope I don't ever see either of them. So when we look at, nope, we're frozen. Sorry. There we go. So in the 1960s now, we started looking at, well, let's recommend some vaccines to hopefully prevent illness, death, disability. So in the late 1960s, these were the recommended vaccines. Now you'll see at the top, smallpox is still there. Obviously that's not on the list today, but to protect from these 8 different diseases, we had to expose kids to over 3,000 antigens just to get an immune response. And that's how the vaccines were in the 1960s. Now we fast forward to today, and this is a much longer list. Everything on the far left column that is routinely recommended, actually influenza should be over there as well. But for this list, there are 14 diseases that we can protect kids from. And for that entire schedule, we only expose kids to 150 antigens. 150 antigens to protect them from all of that. Now, I hear a lot that families are concerned about, exposing their kids to too many things with too many vaccines. And I understand it, and we'll touch on that more in a little bit. But what I think is really interesting is a baby is exposed to anywhere from 2,000 to 6,000 antigens a day, just by being alive, by breathing air, eating food, eating dirt. Kids are exposed to 2,000 to 6,000 antigens every single day. And by exposing them to 150, we can prevent them from getting sick with that list of things. That I think is also really impressive. Can you tell that I get excited about vaccines? So this is the recommended vaccine schedule. There's a lot of different ways to access this, and I had full intention of bringing my multi-folded schedule to show you, which you wouldn't be able to see from up here anyway. I also don't expect you to be able to read all of this. This is readily accessible, and I'm going to give you multiple ways to find it. But I just wanted to go over a few things on this table. The first is this schedule is reviewed every single year. So the Advisory Committee on Immunization Practices, which is part of the CDC, reviews this every year. This schedule has to be approved by the CDC, the AAP, and the American Academy of Family Physicians. So it is constantly being looked at, which I find very reassuring. The other is all of these vaccines that are listed, whether it's recommended or not required, but recommended, all of these vaccines are covered in the state of New Mexico. Every child in the state can receive these vaccines with no cost to them, which is also pretty fantastic. And we'll also touch on that in a little bit. So a little bit about the table itself. Across the top are the ages. Down the left are the different vaccines. Those yellow blocks, that is a range of a recommended age for that vaccine. The green is a recommended range for CatchUp vaccine. The yellow hatched, and there's only one that is yellow hatched, and that is for the HPV vaccine. It's recommended that we give that the 11 to 12-year-old visit. However, you can actually give it down to as early as 9 years of age if you have a patient who you were concerned that they may be exposed to the HPV before they're 11. And then the blue, that is a vaccine that is recommended based on shared decision-making. And the only one that falls under that category is the meningitis B vaccine. So shared decision-making means that it's not a default that the patient has to have that vaccine, that deciding whether or not to give them that vaccine is based on a discussion between the provider and the patient. All of these other vaccines, there's proven benefit to routinely recommend and give those vaccines because the benefit outweighs the risk and the cost. With the meningitis B vaccine, that you might not need to give to everybody. It may be not really your cost benefit ratio may not be there for that one, but you may have patients who definitely would benefit from having that vaccine. I generally recommend this for almost all of my patients, especially those kids who are going off to college, those kids who are going to be living in dormitories, kids going to summer camps, kids who are going to be in close contact with more other kids their age. I think it's really important to consider that. And we also give kids a vaccine to protect them from 4 other strains of meningitis. So this is just an additional 5th strain. So that may change over time, but right now it's not required, but you could certainly give it, and I would strongly consider doing so. And then the gray just means there's no recommendation at this time for that. So the recommended catch-up schedule, there's 2 portions. The top 2/3 is for birth through, I can't even read that from here, 7, sorry, birth through 6. And then the lower is once you have a 7-year-old and older. So this runs through the vaccines that are recommended. The key points I take from this and that I use, I feel like the most important take-home point is I use the minimum intervals. So how quickly, if you have a patient who is behind on their vaccines, how quickly can you get them caught up? Do you have to wait 4 weeks? Do you have to wait 6 months? So I find that this is really helpful when I'm coming up with a catch-up plan for a family to help kind of lay it out and know how frequently they need to come in and how long it's going to take to get them caught up. Right now, we have a lot of families who are behind because their kids were not coming in to receive care during the pandemic. So we're having to make some plans to get them caught up. We also have some families who just decided they didn't want to immunize their kids, and you have to come up with a plan to catch up. And I'll talk a little bit more about that in a moment as well. The other thing that is nice with these tables, and if you have that fold out card, it gives you notes on each of the vaccines. So it tells you for whom that vaccine may be contraindicated. An example would be if you have somebody who has an immunodeficiency, you don't want to give them a live virus vaccine. So the measles, mumps, rubella vaccine, the varicella vaccine, and the rotavirus vaccines are ones that you would not want to give in those situations. It also instructs you as to when you can give vaccines that don't necessarily fall within the recommended schedule. So if you have a family who's going to be traveling internationally and they're going to an area where measles is endemic and you want to protect that child, now we give the first MMR vaccine at the 12-month visit. But say you have a 6-month-old who is traveling to an area where you're worried they may be exposed to measles, you can give them that vaccine. It will not count for what they will need for their required vaccines, but you can give them that vaccine to protect them. So there's a lot of nice information, both in the notes as well as the appendix that comes along with these tables. All right, so who has been asked about an alternative vaccine schedule? Has anybody been asked to provide? Yes, regularly. So I do get asked this quite a bit. It is not my favorite thing to discuss or come up with a plan with, but I think it's important to have the information you need so you can give the best recommendation possible to care for your patients. So I will show you the alternative vaccine schedule that I recommend, and it is this. I don't recommend an alternative vaccine schedule. There are a lot of reasons for this. The first is when we look at how effective vaccines are They are tested and shown to be effective by giving them not only at specific time intervals, but in combination with the other vaccines. So if I have a family who is not following the routine schedule, I don't know, and I can't assure them that their child is getting adequate protection by how they're choosing to immunize their child. Now, again, I hear a lot about that. Well, I don't want to give my baby that many shots. I feel like it'll overwhelm their immune system. It's too much. Let's go back to that. Babies are exposed to 2,000 to 6,000 antigens every single day just by being alive. So it's really, I think that helps put it into some perspective. The other is, and I also will have that discussion, and if they decide they don't want to follow the recommended schedule, then we work it out. But until their baby is fully immunized, that puts them at a higher risk of getting infected with a vaccine preventable disease. They can share it with other people. So it's something to think about, but yeah, I don't recommend anything other than the recommended schedule, and it's called that because that is what is recommended. So the CDC has a lot of really nice vaccine resources. So the tables that I had just shown you, those are put out by the CDC. You can request a copy of that fold out form, but I'm going to show you a lot of easier ways to access it. The resources they have listed, there's information on what is recommended, the schedules. This QR code is great. It'll take you right to that information. There's also an app. So I didn't know there was an app until I was preparing for this talk. So I learned a lot there, but this information is readily accessible. It also gives you information about if you see somebody with a particular disease, what are you required to report? There's also information if you have a patient and you think they've had a bad outcome or a side effect from the vaccine, it walks you through how to report that as well. So has anybody used the vaccine handbook before? Oh, okay. So this app is phenomenal. I have the book, but I mean, let's be honest. Do you carry around a book with you when you're doing your day-to-day? You probably use your phone or your computer a lot more. It is affectionately known as the Purple Book. And on the app, there is so much information here. So you can easily access those schedules, both the routine for kids and adults, as well as the catch-up schedule for kids and adults. You can access information about those diseases that you were trying to prevent. And they also have a number of resources within their own app. And so the next one, which was also something I was not aware of until I was preparing for this talk, is something called COVER. That's the Collaboration for Vaccine Education and Research. So this is an educational program that will, again, give you very easy to digest. It comes in little snippets of information, information on vaccine fundamentals, the diseases that they're hopefully going to prevent. I just want to, and I don't think the pointer is working, but something really cool about this phenomenal educational program, if you look on the top right for cost, it's $0. This is free. You can actually access it directly through the Vaccine Handbook app itself. So I would encourage you to check this out too. It is a nice, easy way to very quickly get that information you need to feel confident in giving recommendations to the families you work with. So this HealthyChildren.org website is one of my favorites. It is something that I give to all families when they first come into the office, families with newborns. This website is supported by the American Academy of Pediatrics. It is written by pediatricians. All the information here is supported by data, evidence. This is all vetted information. So you know your families are looking online. They're trying to get information, they have a question, they go do a Google search. Who knows what they're going to find? But if you can give them some very easy to access resources with good information that is written in a way that is easy to understand, then they're going to feel better and you're going to feel better too. So HealthyChildren.org has information from birth through college age. It has information on normal, abnormal development, nutrition, sleep, trauma, but there's also a lot of information on immunizations. So I would highly recommend looking at this yourself to see what information is there that you might be able to pass on to your families. So I'd like to talk a little bit about exemptions. In New Mexico, there are two categories of acceptable exemptions. So families will often ask me to give them an exemption because they don't want to follow the regular schedule. They don't want to do those vaccines. And sometimes that's appropriate, but most of the time it's really not. And so what I appreciate about the fact that there are laws on the books that protect me is I don't have to make a judgment call about it. There are really only two reasons to approve an exemption. So one of them is a medical exemption. So if giving a child a vaccine will endanger their health or their life, say they had a severe allergic reaction to something, that's a very reasonable reason to give them an exemption. The other is for a religious exemption. I don't have to do those. So if they are members of a religion that believes the body will heal itself and they do not approve of medications or vaccines, that is one. And then the other, if that goes against their beliefs in that religion. So with those, there's a form on the Department of Health website for exemptions. Right now, you do not have to sign for exemptions. However, I strongly suspect you probably will within the next few years. So the last long session of the legislature, a bill did come up. It was Senate Bill 244. And the point of that bill was trying to increase the number of providers who can sign for medical exemptions. So the bill was written initially because a nurse practitioner was caring for a family and this child really did need an exemption, but a nurse practitioner currently is not able to sign for that exemption. And so they really wanted to really improve a family's access to be able to get the exemption if they needed it. The bill ultimately did not pass, but it's going to come up again. So it's good to know about because you may be asked to sign for exemptions. So definitely know those two reasons. And if it does not fall under one of those two reasons, you don't have to make a judgment call. You can just pass them on to the Department of Health if they want to fight that fight. So with vaccine hesitancy, I don't say refusal because most of the time it's not refusal. Usually it is hesitancy. And when a family comes in and they either don't want to follow the recommended schedule or they're not sure, they generally fall into one of three categories. So the first is there are people who come in, they don't even want to talk about it. You can ask, they don't even want to discuss it. There is nothing that you are going to say or do that will change their mind. The second is those who they're just kind of leery about it. They're not sure, they're kind of uncomfortable. They initially say no, but they're willing to discuss it with you. The third, those who just have questions. It's not that they're against vaccinating their child, they just need more information. So I would like to focus on number 2 and number 3, because that first group, you're just not going to change their mind. You just have to agree to disagree. And you can always circle back to that at subsequent visits, but not worth pulling your hair out, at least for that day. So with families who are hesitant, it's most often that they do have questions or they are worried. I always ask their permission, is that okay if we discuss this? And if they say no, then say, well, great. I'll ask you again in the future. Now, I do know that there are pediatricians who, if a family decides that they're not going to vaccinate their kids, they won't see them. And I understand that, and that is their right. However, I feel that, I have long-term relationships with these people, hopefully. And if they come to see me and they get to know me and I get to know them and they become to trust me, then usually we're able to make some progress with this. But me telling them they have to, or if they don't, they're bad parents, or I won't see them, you're not going to get anywhere with that. So I always feel like it's more important to try to maintain that relationship, answer their questions, make sure that they understand that they're putting their children at risk, but also just to be open to circle back at subsequent visits. So what are their concerns? Often their concern is something that, don't quote me on this, it may be something that you think is entirely ridiculous. To them, it's a big deal. They're really scared of it, but it's something that we all know is absolutely not a risk. So one of them was at a family, they were really worried that the hepatitis A vaccine was going to give their child diabetes. And I don't know why. I think they heard it from somebody, but they were really, really worried about it. And so it took several checkups for us to finally come to the point, and me basically proving myself that they trusted me enough to understand that actually that information wasn't correct. I always ask them, what resources have you used? So another family told me, and she apologized when I asked her, well, tell me, what information have you looked at? Where did you get this information? And she said, don't be mad. So if somebody starts what they're going to say with don't be mad, you better just sit down. So she said, I did a Google search of vaccines and death. So what information do you think she found? Was it reassuring? Did that encourage her to want to immunize her kids? No, it did not. But at least it gave us the opportunity to talk about the fact that maybe the information she was looking at was not really based on fact and data, and then to try to guide her towards some sites with accurate information to help her make those decisions. She ultimately vaccinated all of her kids, but you have to find out where are people coming from. And then, as much as we all know, vaccinating kids does not give them autism, but there are families who they have somebody in their family and that child was fine until they got vaccines, and then they were not fine. So in their mind, even though all the data in the world shows there is no connection, for them there is. And so you have to understand and just respect that and keep giving them the information they need, answer their questions. And so when it comes to shared decision-making, that's where it is you want to make sure that you're both heard, you're both sharing your information, you're giving them the information that they need, and hopefully you can come to some agreement. Now, there is something called Ask, Tell, Ask. I know that there's another lecture, I think it's tomorrow, on COVID vaccine hesitancy. And so you may, if you go to that one, you'll hear some of this again. But this idea of ask, tell, ask. So ask them, so I understand you were not sure about doing vaccines today. Is that okay if we talk about it? Again, if they say no, then okay, we'll circle back at their next checkup. If they say, well, yeah, I was worried about this, great. So take what they're worried about, tell them the information that they need to know. And then once you've kind of talked it through, then ask again. So now that you understand that the hepatitis A vaccine will not give your child diabetes, do you feel comfortable proceeding with that? So it's a way that they feel heard. You can kind of formally go through a process. You can identify those people who are just not interested to talk about it and not going to talk about it. So it's a better use of your time. But I think it's, as far as when people are making decisions and they're concerned about their kids, you want to make sure that they feel heard and that they know that they're making the best decision they can for their child. For planning, so circling back to that vaccine plan, when people tell me they don't want to do the recommended schedule, that's their choice. But I no longer make up a schedule for these families. So I used to sit and write down every vaccine they needed. Did they want to do 1 or 2 or 3 at a time? How often they were going to come in? And inevitably, I would spend all of that time, have something in their chart, and they don't show up and they don't follow the plan. I still work with them. We still create a plan, but I put the responsibility on them to sit down and write it up with me. So if they don't want to follow what's recommended, then they need to have a little, skin in the game and help come up with a plan. So generally we'll come up with a plan. I will scan it into their chart. We will schedule regular vaccine visits. Because of COVID, we had to change how we provided vaccines. So here was a silver lining of a pandemic. We no longer require people to come into our office to get their vaccine. We actually can do vaccine visits in our parking lot. So we know they're coming in, they've scheduled their appointment. They call when they're in the parking lot. A provider gets on the phone to review the vaccines that they're getting, discuss side effects, answer any questions that they have. And then the medical assistants go to the parking lot and give those vaccines in the car. So it's actually been very successful. I think the kids generally don't get as nervous or scared because they can stay in their car seat. They aren't hearing other kids screaming and crying in the office. They're not waiting. So it's something to think about if that might work for where you practice. It's a really nice way to try to get those vaccines caught up. Also, when somebody brings their child in once a month for one shot and they do this week, or I guess month after month after month after month, and they come in our building, those kids hate us. And it's not their fault, but it's very traumatic for them every time they come in the building. So it is really nice when they have to come in for a checkup, that it's fun. So it's not just the shot visit, it's actually they get to come in and they interact with staff and get stickers. And so I think that's helped. The other thing is every visit has the potential to be a vaccine visit. So don't just reserve that for a checkup. It's really important to check their vaccine records on NMSIS to see what they need. So even if they're sick, if somebody doesn't have, if they don't have a high fever, they're not very sick, you can still give vaccines at those visits. So for teenagers who generally we don't see that often, if they're in for any reason at all and they need a vaccine, please give them that vaccine. Don't make them have a checkup to get it. That's really the best way to help these kids get caught up. The Vaccines for Children program is an amazing program. So basically the federal government recognized that immunizing people is one of the best public health measures that there is. And the Vaccines for Children program enables us to do just that. They buy vaccine and then enable us to give it. But New Mexico is actually, this is something we're really good at. So all of those health indicators where typically we are like 48th, 49th, 50th, we are way high in immunizing our population because of the Vaccines for Children program and the fact that New Mexico is a universal purchase state. So what that means, being a universal purchase state, is the state of New Mexico said, you know what, we're going to purchase vaccine for every child in our state. Whether you're insured, whether you're on Medicaid, whether you're uninsured or underinsured, we're going to provide you vaccine. So providers can sign up to be a part of this VFC program. We order vaccine, the state ships us vaccine, we give the vaccine. For those families who are privately insured, the state then invoices their insurance company and they get repaid for that vaccine. For those kids who are on Medicaid or that's just covered by the state. And then for kids who are underinsured, uninsured, still paid for by the state. So this is really a phenomenal program. Not every state in the US has it, but we do. And so if you are not a VFC provider, I would highly encourage you to become one. It is some work to get set up to do it. There's a ton of education, but it is really one of the easiest ways to make sure you can immunize your kids. The other is vaccines are expensive. So this program allows you to get the vaccine you need to immunize your patients without having to pay for it, all out of your pocket. And then just one resource that I think is really cool, this VAXQNM.org. I'm sure you were asked, oh, can I get my shot record? I need my child's shot record, especially with school registration coming up. You're going to be asked for lots of shot records. But this enables a lot of families to actually get that information for themselves. So with entering a little bit of information, families can actually see their child's shot record. They can print it, they can email it. It does not work 100% of the time, but it's worth a shot. So this is great. The other, again, the cdc.gov has a lot of really nice information, the HealthyChildren.org. Immunize.org, I didn't really talk about them. That is also a phenomenal website with a lot of information. And then NewMexicoHealth.org has not only information about the VFC program, the required vaccines, they also have information about the diseases that they are hoping to prevent, but they also have the schedule of the vaccines that are required for our state. So a child, whether they are homeschooled, public school, private school, parochial school, they are required to have vaccines. This is the vaccine schedule, and I will tell you, it looks almost identical to the one from the ACIP. The only thing that is not required, there are two. So one is meningitis B. Right now, that is not required. And the second is the HPV vaccine. That will likely change. It actually was supposed to have already been implemented, but with COVID, there was just no way it was going to happen. So keep your eyes open for that. It likely will be within the next couple of years. And then also on the DOH website, there's information about exemptions as well. So just to review, why do we vaccinate? Because vaccines save lives. So I'm hoping that I've given you some information that will help you feel more confident about discussing it. Also, places where you can go to get better educated yourself. and to also help with some vaccine hesitancy. So with that, I'd like to open it up for questions. Is there not a single, did I talk way too fast?
So we have 3 separate children at 14 weeks, 1 day, 14 weeks, they weren't eligible for rotavirus. I'm just curious how you handle that second. You know, I agonize over it and then it's not getting it. You get it? Where do you get from?
Yeah, that is, I mean, if you're giving a vaccine that is outside the recommendations, you can get in trouble with the VFC program. I think that, you know, it is hard because you want to try to offer some protection, but you also have to look at the data. And if a vaccine has been studied, but not shown to really be effective after a certain age, then you really don't have what you need to support doing it. So I would recommend just following the schedule. I mean, if you're a few days over, is that gonna make or break? Probably not. But yeah, I would recommend just following the schedule just to prevent getting in trouble with VFC. And also just, you have to go based on the data. All right. Well, thank you all so much. I really appreciate the opportunity.